Hi, good morning, everyone, and welcome to the second part of the lecture of the medical interview. In the first lecture, we dealt with the four habits model, and just as a reminder, the four habits model, when with respect to the medical interview, is investing in the beginning. That's the first habit. The second habit is eliciting the patient's perspective. The third is demonstrating empathy, and the last habit is investing in the end. So, in the previous lecture, we talked in great detail about how to invest in the beginning. In this lecture, we'll talk about the last three habits: eliciting the patient's perspective, demonstrating empathy, and investing in the end. So, what do I mean by eliciting the patient's perspective? When the patient is in front of you, you are the doctor, you're the medical student. As medical students, you will be expected to take histories from patients, and you just need to remember some skills to elicit the patient's perspective. You can either ask the patient's ideas, you can either elicit specific requests, or you can explore the impact on the patient's life. Now, remember, you don't have to do all of these. It's very context specific. Depending on what the patient comes to you with, you may not need to elicit the patient's perspective at all. But if you need to, you can use either of these, one, two, or three, or you can use any combination of them, right? So again, to reinforce, you can either ask the patient's ideas, um, you can elicit specific requests, or you can explore the impact on the patient's life, right? Again, very context specific. You may not need to ask all of them, right? So if you do have to ask the patient's ideas, there's a way to go about it, right? So, so this is, remember, you're asking these questions after you have gone through your history taking, right? Your history of presenting complaint, using your, depending on what the patient presents with, your Socrates approach. Um, if it's chest pain, alleviating or relieving factors. If it's headaches, associated symptoms, things like that, right? Remember your drug history, uh, previous surgical history, past medical history, social history, rather family history, right? So all these things you're asking after the after you've taken your patient history, right? Um, Again, it's context specific. You may not need to ask these questions, but if you have to, sometimes, occasionally in the interview, sometimes you don't get very much information from the patient, right? And the patient, you may notice that you may get non-verbal cues that the patient is very reticent to talk about his or her issue. But they've come there before you, right? So obviously they're worried about something. Nobody comes to the doctor um, just on a whim, right? Um, so everybody has some kind of issue or problem. So to elicit you could ask questions if you're asking the patient's ideas. You could ask questions like, "What do you think might be causing your problem?" Right? Or you could say, "Well, what worries or concerns you most about this problem?" Um, so in the first one, what do you think might be causing your problem? The patient might be presenting with very, very non-specific symptoms, and you might be a bit stumped in the interview. So this is a good way of assessing the patient's point of view, right? Because when you ask this question, the patient then is when you might get the most information. If the patient actually has presented a problem to you, you ask them what worries or concerns you most about this problem. Um, and then you can also ask, provided again, very context specific, if you have gotten a fair bit of details about what the patient presents with, chest pain, abdominal pain, whatever, you could ask them, well, what have you done to treat your illness so far? And you may get a wealth of information again. Again, in the real world scenario, not really applicable to our situation where you're involved with disseminated patients, right? But occasionally in the real world, when you're on the ward or in the side rooms, um, if there are loved ones in the room or family members, you could feel free to ask them about their ideas as well. And you may get more information from there as well. So just going back, so we dealt with asking the patient's ideas, right? So we're going to talk about eliciting specific requests now and how to go about that. And this is fairly easy to do, right? Because you might, so at the very beginning of the interview, you usually ask the patient, well, how can I help you? And sometimes, as I said, patients don't come to physicians on a whim, right? They all want something. Um, so some of them might say, well, doc, I was hoping just for sick leave so I could jump up on carnival Monday, right? Well, doc, I have this cough, I have a fever, I know I have a chest infection, just give me a week's supply of antibiotics and I'll be out there, right? Um, some patients might have their family members nagging them at home to go and see a doctor. So it might be saying something like, well, my kids won't get off my case. You think I need to go refer to a dietitian? because my diabetes is out of control, right? Um, so going back again, so that's elicit specific requests, right? The next one is in how to explore the impact on a patient's life. Again, very context specific, right? So depending on how much information you get from the history of the presenting complaint, you could ask them, well, how has the illness affected your daily activities or your work or your family, your interactions with your family, right? An alternative question is, right, well, what are the main problems your illness has caused for you? So that was, we dealt with eliciting the patient's perspective, right? So the next habit is to demonstrate empathy. Easier said than done. As I mentioned in the lecture previously, not all of us are natural empaths. Some of us may have to work at showing empathy more than others. That's fine. But you, we'll seek to equip you with some skills to demonstrate empathy, right? So how do you demonstrate empathy? You be open to the patient's emotions. Sometimes the patient would feedback on you, whatever the patient's emotions. They may be very upset, they may be angry, they may be frustrated. That will feedback on you, and you could tell how the patient is feeling by the emotions that the patient stills in you, right? Another skill to demonstrate empathy is to make an empathic statement. I'll show you what kind of empathic statements to make. Remember your non-verbal skills, which you learned about last year, so you could convey empathy non-verbally. And again, be aware of your own reactions, because that could help you be in tune with the patient, right? So when you're open to the patient's emotions, respond in a culturally appropriate manner to changes in body language and voice tone. Remember, some cultures are very high contact, some cultures are very low contact, so um, patient specific. When I talk about empathic statements, what do I mean? Well, actually, what are not empathic statements, right? So don't say things that, well, it can't be as bad as all that, or don't say everything will be all right. Don't say don't worry. Most of the time, it's a false positive, right? That's context specific. So whatever test you do, so don't say things like that. These are not empathic statements, right? So empathic statements could take the form of queries or clarifications or responses, right? So the query, empathic statements, queries, you could say, well, would you or could you tell me a little bit more about that? Because it shows that you're interested in what the patient is saying, right? Or you could say things like, well, what has this been like for you? Is there anything else? Are you okay with that? Right? Or you could show empathy by asking clarifications, right? So you could say things like, well, let me see if I have this right. I want to make sure I really understand what you're telling me, I'm hearing. I don't want us to go further until I'm sure I've gotten it right. Right? So these things, all of these, so you don't have to say all, you could make one or two, right? But this shows the patient that you're relating to them, you're really interested, you're showing empathy in what they came to see you, in the reason they came to see you, right? And then you could show empathy by making responses. So again, you don't have to do all of them, right? You don't have to show you could show empathy by making queries or asking clarification questions or making responses in response to what the patient tells you, right? So the patient is telling you something about their symptoms. You can say things like, well, that sounds very difficult, or I can imagine that this might feel, right? Or you could say things like, anyone in your situation would feel that way. Or you can see, I can see that you are, and especially the last one, I can see that you're very upset. I can see you very frustrated. I can see you very angry, right? It shows the patient again is the underlying message of the patient that you are interested in what they're saying, right? Again, empathic statements name a likely emotion. You seem really worried, or you seem really upset, or you seem really frustrated, right? And if the patient is coming to you and have made some kind of effort to address their problem, like if they have diabetes and they know to themselves their blood sugar isn't great, so they've made efforts to change their diet or be more compliant, address their non-compliance, compliment the patient on efforts to address this, right? And again, remember your non-verbal skills. So I didn't teach you these non-verbal skills in a vacuum. You could use them to great effect in the medical interview, right? Use a pause. So just sometimes you just need to let the patient talk, right? Um, or facial expression to convey empathy non-verbally, right? And this very as we in times of COVID now, we not we don't we're not as touchy feely as we used to be, so it's especially important in these times, right? And again, when it comes to empathy, be aware of your own reactions. If the patient is angry, you see the patient is angry, and what the patient is telling you, the reasons for why for their anger, you might start to get angry as well, right? So it might be a clue to is a clue to you to how the patient is feeling. If the patient is sad and that still feels the sadness in you, you might get a clue to what the patient is feeling, etc. Right? Right. So we come to invest in the end. So we dealt with eliciting the patient's perspective, right? So we spoke about asking the patient's ideas or eliciting specific requests and or exploring the impact on the patient's life, right? We spoke about demonstrating empathy and the necessary skills, how to go about demonstrating empathy, right? Either by being open to the patient's emotions, making empathic statements, whether it's queries or clarifications or responses, right? Remember to convey empathy non-verbally, especially important in the medical interview, right? I know you only have 8 minutes, but you can do a lot in those few minutes. And again, use your emotional response as a clue to what the patient might be feeling. So then we're investing in the end of the interview, right? And this is as important as the beginning, because if we end the interview, if we terminate the interview very, very abruptly, the patient feels at a loss, right? Because they want to know, well, the doctor spent all this time investing in the beginning and talking and asking these questions, and then he or she just ends the interview so abruptly that the patient is left hanging, right? So you need to acquire some skills investing in the end. So when you're investing in the end, depending on, again, it's very context specific. It depends on what the patient came to see you for, right? So you can either deliver diagnostic information, usually the case, right? But not always. Sometimes the patient, you just need to educate the patient, so you provide education. If you are delivering diagnostic information, involve the patient in making decisions about their care. Remember, we're not medical paternalists anymore, right? And then complete the visit, right? So frame the diagnosis. If you are delivering diagnostic information, frame the diagnosis in terms of the patient's original concerns. So the patient may tell you, well, doc, I like to run around to the Savannah, right? Um, you frame the diagnosis, well, okay, well, I think this is um, a torn cartilage. I think you will need to stop running around Savannah for a few weeks, but I think with adequate rest, you'll be able to resume a normal activity. That makes the patients happy, right? If the patient say, well, doc, I have to drive for a living, again, I think it's just a bit of cartilage in your knee with some rest. You might need to take a couple of weeks off, but then you'll be fine to resume your normal activities, right? So reassure the patient. If you're providing education, explain your rationale for tests and treatments. Review any possible side effects and expected course of recovery. Discuss lifestyle changes that are consistent with the patient's lifestyle, culture, values, and beliefs. And if you can, provide resources. And remember, online is a very good resource, right? Don't forget to involve the patient in making decisions. You're promoting patient autonomy. So discuss any treatment goals, express respect or tolerance towards any alternative practices the patient may have. Assess the patient's ability and motivation to carry out the plan and explore any barriers. So ask them, what do you think we can do to help overcome any problems you might have with this treatment? And very important, test the patient's comprehension by asking the patient to repeat instructions. So just that I'm sure I've explained things, can you tell me your understanding, right? And then you complete your visit. You summarize your visit, review the next steps, ask any additional questions. Do you have any questions? And close the visit in a positive way. It's been nice meeting you. See you again. Thanks for coming in. All right. Okay, so I hope this lecture has been useful, and it will replace the face-to-face lecture that we missed last week because of the final MBA examinations. And I'll see you all for dealing with challenging patients. Okay, thanks very much.